Right, the medical burden in the Greater Seoul area is reportedly nearing its capacity. In fact, authorities have raised the alert level for the area to very high. Yeon-seung joins me now to tell us what this means. Yeon-seung, what does it mean?
Right, so I want to start you off by taking you back to last week to really give you a full picture of what this all means. So last week, when the capital region's ICU beds first reached 75% capacity and there were more than 500 critically ill patients nationwide, a lot of people had started to wonder, does this signify an end to our gradual lifting of restrictions? You know, health authorities had previously warned that they were going to pull the plugs on the easing of measures if the healthcare system is at risk of being overwhelmed. But authorities have continued to reassure people that everything is still well under control and that we can still move forward with the gradual easing of measures. Authorities also announced last week some of the specific criteria they're going to take into account in deciding whether changes are needed to their exit strategy. They said they're going to look at 17 indices, including the number of ICU beds filled and the basic reproduction number of the virus, conducting a weekly review of where the country stands in terms of virus threat. They are using a scale of 1 to 5, with 1 indicating a threat level of very low and 5 being very high. And during the announcement on Monday morning, they said the capital region now stands at a level 5, the highest tier in the threat level, and level 4 for the rest of the nation.
Right. Yeon-seung, if I remember correctly, last week we spoke about the threat level in the metropolitan region standing at moderate and low elsewhere outside of the capital region, that is. How did the situation escalate so quickly?
Well, ICU beds have been filling up at a very alarmingly rapid rate. When health authorities first made the announcement last week, the capital region's ICU beds were a little over 75% full. But as of Tuesday, more than 83% of the ICU beds in the capital region are occupied. In less than a week, this figure saw an increase of around 8 percentage points. Also, as of Tuesday, more than 830 people were on the waiting list for beds. As for hospitals that specialize in infectious diseases, the capital region is running at 77% of full capacity, while that figure stands at around 57% for areas outside the capital. And of course, there's the issue of rising infections as well.
Infections in the capital area have continued to rise and saw an average of 2,174 cases in the past week. That's a 27% rise from the week before and a record high.
Right, I see this. So the daily tally is also a source of much concern, of course. Right, Yeon-seung, thank you for now, but stay with us for the extended talks.